Welcome everyone. Newslaundry is going to be hosting a series of sessions that will focus on tackling the second wave of the coronavirus pandemic that India is grappling with. This is our first episode. I have with me a very distinguished panel, Professor Nirmal Ganguly, who's former Director General of Indian Council for Medical Research. Thank you, sir, for joining us. And Dr. Priya Sampathkumar, who's Chair of the Infection Prevention and Control Committee at Mayo Clinic in Rochester. As we record this show, COVID has killed more than 2 lakh Indians. 3,000 have died in the last 24 hours. There were 3,62,770 fresh cases and 3,286 deaths reported in the last 24 hours itself. Those of you who are in India, you know we are swamped with SOS calls. Every one of us know either a family member or a friend who's grappling with the virus, grappling with the disease. So the idea behind these sessions is really to help us gain a better understanding of the virus, the disease, and really do whatever we can do to stay protected. So I'm going to jump in right into this. The idea for this particular session for me was really to talk to Professor Ganguly and Dr. Priya and really clear up some basic misconceptions that we've had about the virus, about the disease. So my first question is actually, I'd like to go to Priya. Over the past 2 weeks, I have, at least in my friend circle or at least on social media, heard a lot of people say that, they have not gone out of the house at all. They haven't met anyone. No one's come to their house and they've still contracted the virus. Is it because the virus is airborne? What do we really know about virus when it comes to it airborne? And why do you think that there are these anecdotal cases, at least, about people just getting it while they're sitting in their house, not meeting anyone?
So I work in infection control, and the term airborne has very specific meanings. For the general public, it means something different from what it means in the medical field. So let me say that the virus is borne by droplets. These are particles that are expelled when you cough, when you breathe hard, when you sing, etc. These droplets, you need to be, they're not technically airborne, because airborne means they stay in the air for a long time. If you walk into a room where someone with COVID was, and an hour later, and you get COVID, that's how airborne infections spread. COVID is actually not airborne, however. I mean, there may be a tiny, tiny, tiny proportion of cases that are spread by the airborne route. Mainly, it's spread by being within close proximity to people. So total reports not be worrying. If you actually stay home and you're not interacting with people with COVID, the chances that you will get COVID are minuscule. And what you need to do really is avoid crowds, avoid having people come talk to you without a mask. And I would really wonder if the people who are saying they got it without ever stepping outside are just forgetting a couple of interactions previous few days.
So you're saying that these anecdotal instances shouldn't worry. Our main goal should be to stay out of crowds and be very careful interacting with people.
No, and a crowd in the current situation is anything more than 3 or 4 people. So, anybody you interact with today should be with a mask.
Professor Ganguly, we're all in lockdown right now in Delhi. For those of us who are in Delhi, Karnataka has also started one. How do we stay protected at home? There are, now we've been told that you should mask up even when you're home. And Delhi is also going to start an intense summer season. And I've heard some suggestions that we should keep our rooms ventilated, which means don't use the AC.
Yeah, well, you have rightly said, room should be ventilated. If you have air conditioners, which are one of the culprits, there should be a good variety. Split is okay, but it should have a good air circulation. And although there is an advisory for wearing mask at home, it is essentially for those because people go on visiting, even if you have lockdown. Sometimes relatives and friends, the servants who go out, they come. So you always have visitors. So if you have new visitors whom you do not know, who are going out, you should get protected. Actually, Manisha, in my lifetime and many people here, who, whatever is their age, they have never seen anything like this. And so at this time, it is absolutely out of control. So that is why you were saying that whosoever you know, they are affected, and this chain is going on very rapidly. So now two lockdowns might bring it down, but at this given moment, it will go through its own course. Because I have studied very closely what's happening around the world. Well, this virus is different. It doesn't respect geography, it doesn't respect cold or hot weather. It just moves. And this is the first virus which is doesn't spread through the infected people. It spreads through asymptomatic the super spreaders. And normally, when you have seen whether it was United States or any other place, it had a rise and then it had a plateau. It didn't really dip to non-transmission level. And many events which happened in those places, they actually became super spreader events. In India, there were the same thing happened. We became very happy when the things dropped, but it was a plateau. The transmission was still going on in a low key. So we had 4 or 5 very super spreader events. We had 5 states went on election. We had Kumbh Mela. We had farmers agitation where 3 states participated, and then the trains, etc., Bombay trains, etc., they opened up. So people were coming and going all around. And then the behavior had also changed. There was a complacency in the people's mind that we have now the COVID is not that important. So particularly the poor and others who earn their living through building activities, through shops and other activities, melas or mandis, they were they gave up wearing masks, and the mask is little costly. In India, there are 330 million people who can buy anything. They can buy their treatment in United States also. However, about 700, 800 million people in India, they have nothing. So they can't even afford masks. They were wearing masks which were old, very old masks, and months after months they washed it and they wore it. So, so that was another major issue, that whether our masking was appropriate behavior-wise or not, and the crowding happened.
So Priya, now we are hearing that no cloth masks. You have to wear a surgical mask and you have to double mask.
Yeah.
That's now the
So I completely disagree with that.
Okay.
I completely disagree with that. I'm sorry. I need to get this out there. So in the United States, which is the richest country in the world, a few months ago, we did not have enough medical grade masks. And we said, wear cloth masks. Cloth masks work. In many cases, the cloth masks actually work better than the medical masks. What you need is a mask that fits well around your nose and mouth. And most importantly, it has to cover your nose and mouth. The problem is not that the cloth masks are not working. The problem is they're not being used correctly. I have a problem with the double masking issue, just because if it's uncomfortable to breathe, because you have 2 masks on, people are going to pull it down. And that is a problem. So I feel very, very strongly about this. Where any kind of mask you can find, a cloth mask, provided it has 2 layers of cloth, is enough. And in some instances, it actually works better than the cheap counterfeit medical masks that you're buying in the store for enormous amounts of money.
It's a very good point, because it's really hot now in India, and it's true, like if you're going to double mask up, you're going to sweat and you may want to pull it down. I know
exactly.
Being in West Bengal while we were covering elections, beyond a point it would get so hot that we just pull up masks down. So I guess that so cloth masks are fine, you're saying. It's
Yes.
fine to wear it as long as it protects your mouth and your nose and it's tight.
Not incredibly tight. Again, it should be close fitting. It does not need to be tight. It just shouldn't be, flopping around.
Okay. What do we know about lockdowns? I'll just come to Priya and then I'll come to Professor Ganguly. Lockdowns. Now, there's a lot of debate in India. There's a section that believes that it doesn't help. It only, can help, slow down the spread for a bit. But you will eventually have to get out, because people, you need economic activity. You need people to get back to jobs, especially in India, because you have the unorganized sector. A lot of people are employed in the unorganized sector. So, how hopeful should we be about this 2-week lockdown in Delhi? and lockdowns that other states like Karnataka are doing, are they helpful, or is it just something that's just going to pause for a little bit and then you're going to go back again to your life and then you're going to go back to again, seeing a surge in cases?
So lockdowns absolutely work. They will definitely slow the cases. The problem is that it comes at an economic cost, which I'm totally sensitive to. But at this point in time, we need a lockdown just to buy some time. I am so far away from India, but I am getting phone calls from people in India who are dying, who are unable to reach the hospital, who are unable to get oxygen, who are unable to get any medications. What the lockdown will do is enable healthcare to get a little bit more prepared, slow the spread enough that the system is not, it's already stretched so thin. I think we've reached the breaking point, but maybe rebuild capacity a little bit, get the international community to step up, send oxygen, send ventilators, send the things that India needs to get there. So the lockdown will buy you time. And I think that at this point, it's essential. I totally understand all the economic things. And, there are so many people who are against lockdowns for that reason. But right now, a lockdown will result in saving lives.
So those of us who can afford to stay home and can work from home should stay at home.
Absolutely. And what is just absolutely criminal at this point in time is having a wedding, having a large gathering. That is just criminal.
Okay. Professor Ganguly, now a lot of people are recovering. I mean, I know the situation is really dire. We're hearing of deaths, we're hearing of people gasping for oxygen. But there is the side to the disease that a lot of people are recovering at home. Now, I just want to ask you, for those of us who have caught COVID and who are taking care of themselves at home, at what point should we seek medical help? When do we think, okay, now I need to approach a hospital, or I need to go to a doctor, or I need to start getting attention, medical attention, other than from what I'm doing at home?
So if the oxygen level is dropping below 95 or 94, sometimes you can even, if you take prone breathing, you can build up oxygen even if you are in 90s. But essentially, if it is dropping, that is one indicator you should seek help. And everyone normally has an oximeter these days. The second thing is that if some of the clotting problems are coming up, your platelets are dropping, your D-dimers are increasing, your ferritin levels are going others, then you need to seek help. Then if your CT grade is above 14 or 15 or above, you need to seek immediate help. So these are some very ready reckoners where a person should seek help. And the help is now almost when the health system has collapsed. So you may try to seek help. So one of the major methods of seeking help is that many of the organizations, major hospitals, have opened up home care system. So there are packages, they take care of you at your home if you can taken care by an oxygen cylinder and others. There is another organization which has come up, which is setting up an ICU at your home also. They are charging 28,000 rupees per day and minimum of 10 days. So 3 lakhs rupees if you have and you can spend. So there are many innovations which have occurred. But main thing is this, that there is so much demand and the current hospitals are totally full. They don't have, I get so many desperate calls that please get me a home because I'm attached to several hospitals over here. But now I'm unable to get get any. And people are moving from one place to another, desperately seeking these places. So one of the things which I will suggest, that we have different administrations around Delhi metropolis. So Delhi NCR. So sometimes it is done by UP, sometimes it is by Haryana or Rajasthan and Delhi government. We need to have a centralized point, and where anybody there should be a call center with doctors. Anybody who is seeking help, if they know what are their parameters, they should direct people to an appropriate place, and they should be having those holes that they could put those people in appropriate places. So one of the main issue is an ICU. So now lot of ventilators etc. are coming, and the other issue is oxygen, and oxygen is also coming. Oxygen, main problem in oxygen is that there is no shortage of oxygen. There is Linde, there is Inos, there are the Ambanis, Tatas and other steel companies and others. There is enough oxygen is produced. So majority is used for industrial purposes, steel industry, in mining industry and others. A very small number was used for this. So even if you stop the steel industry oxygen, you need cylinders to fill them, and then you need to take them to the places. So some of these are in remote places. So now this government is trying to solve it, but in future we will have to sort this out. So we will have oxygen, and we will have we are now expanding the capacities, creating more oxygen beds. 2 or 3 days, perhaps we will have some kind of an order here. But
Yeah,
initially there was a
I
chaos.
Yeah, I just want to give your viewers one small tip. There is an organization called India COVID SOS, which has a lot of very useful information that's easily readable. It's tip sheets to do all the things that Dr. Ganguly said. It translated into multiple languages, India COVID SOS. So if your viewers could go look for that, it'll give them all that information in a one-page infographic.
And one more thing I want to ask you, Priya, was that so some of us have oximeters because we bought it a while ago during the first wave, because we were told that, okay, this is something you should have at home. It's very expensive today. The prices have doubled. In many cases, it's not available. Is there a way of figuring out your oxygen levels without the oximeter? Something that rings an alarm bell and says, okay, maybe I should get help now because is there like
Yeah.
a
Yeah, so the oximeters are great, but if you don't have them, don't panic. Don't, run around trying to find one at this point, especially if you are sick. You need to stay home. One easy thing to do is just focus on your breathing and think about, are you breathing comfortably or not? And if you're panicking, you are going to be breathing fast. But over time, if you can slow your breathing down and you're breathing comfortably, you're probably fine. Don't need to worry. If you were fine and your breathing has now slowly started worsening, you're finding it harder to catch your breath, or if you're taking care of someone and that person is getting a little confused, that could be an indicator that their oxygen levels are going down and they should seek help at that time.
Okay. And so that's possibly the most important thing that you need to be watching out for, right? Your oxygen levels. There's also a great rush for medicines now. I'm hearing that in Delhi, you don't have basics like paracetamol available in the market. And even FabiFlu, which was, till 1 month ago, this wasn't a medicine that was hard to procure, but it is happening. So now you don't have FabiFlu. A lot of people are complaining about that. Remdesivir, of course, there's a huge rush for it again. Are there any medicines that we need to stock up at home? Of course, we can't right now because there aren't any available, but should we be panicking if we can't find these? And is there anything that we should be taking at home, or is it something that we have to strictly go by prescription?
So really, there's a lot of myths out there about these medicines. That's why there's been a run on these medications. I want to really be very, very clear that FabiFlu does not work. Ivermectin does not work. Doxycycline does not work. People are going to inordinate lengths to try and find it. None of these treatments work. If you're feeling unwell, a paracetamol can make you feel better, and it's perfectly fine to get it. And most people, if they search around in their cupboards, can probably find some paracetamol. There's no medicine you should be stocking up at home, because really everything is in such short supply, and stocking up in the event that you might need it is taking that medicine away from people who need it right now. So the answer to stocking up is no. The second thing is that really the only proven medications or proven treatments for COVID is oxygen that is life-saving. The other medication that is indicated when your oxygen levels are going down is medications called steroids. They come in many, many different strengths and names. And again, the info sheet has all that listed. Remdesivir has very, very marginal benefit. It is not a life-saving drug, and nobody should be spending time or energy searching for it. Same thing with plasma, does not save lives. And people donating plasma, people trying to get plasma is also stressing the healthcare system very, very thin.
Okay, we're going to be starting our vaccination program, and the government of India has at least announced that everyone above the age of 18 can get a vaccine, though there have been a lot of issues registering for it. So, Professor Ganguly, do people above 18 who are healthy need to get it? Like, is it? I mean, I'm just thinking about young people out there in their, from 18 to say early 30s. Do they need to rush to get vaccinated right now, or can we?
No, actually, I'm 80 years old, so I had my vaccine, but still I got infection. So after double vaccine, so
Did you get it after the 2 shots?
Although milder form.
Okay.
But the main thing now is that we need about immediately 300 million doses. So one company is making 70, another is making 16 million doses. So we need to find out solutions to this. And I have few suggestions to find out the solutions. The first is that we need to scale to spread it around. When we can't do it immediately, because now in India, no vaccine advocacy is needed. So much people are worried. People will be coming crowding the places for vaccination. So we need to phase it out, and people should know how and when to go there. Now with the Covaccine app has crashed today because you had to do 18 plus thing. But my first thing will be those who got the first dose, they should get the second dose first. That is a priority. The second thing is this, that please scale it up to different categories. One of the first categories should be those who go out for work, and they are about 29 and above, 29 or 25 and above. They go out for work or different kind of work. So we have done up to 45 and above. So we need to now go up to 30 to 45, and later on bring it down. So if we don't phase out, then we will not have enough vaccine. We need to import vaccine also. Like Sputnik vaccine has been given to us, has been now approved. So the 6 companies will be making it. It will be few months before they churn it out. So we need to buy it from Russia. We need to put an advanced order. Luckily, AstraZeneca vaccine, which United States had, it is not using that, and it is sending it to India. So we will have some 200 million doses or 100 million doses of AstraZeneca vaccine from United States, because they have now surplus vaccines. So they are now allowing the other. The second, my third advice is this, that now the United States has allowed the raw material export. So it will be possible to get raw materials in India to expand the capacity of production. But to get a GMP production, it takes some time to expand the facilities to GMP grade. So we could do GMP compliant for the moment, because if we are not exporting, we are using it within India. GMP compliant is okay with us if all the other parameters, batch parameters, are similar. So we need to be very smart of how we vaccinate. It is going to take 3, 4 months, 5 months. The United States was lucky there is a vaccine hesitancy there. They were lucky they could vaccinate very large number of people, and you could see that it had an effect. In India, up to now, we actually managed it of what we had, and the vaccine infrastructure we had. Now we will have to expand the infrastructure. We will have to train more people. There will be vaccinators in the secondary districts, tertiary towns and others. That also we need to look at the areas, because there are mutants going on now. And these mutants are very, very dangerous. They are spreading very fast. So we need to find out about 11 or 12 or 14 states where we have the real problem of the totally uncontrolled infection. We need to vaccinate them earlier and gradually go to others. So we have to create a smart strategy. At the moment, policy is that India wants to immunize everyone 18 and above. So there's the policy. But how do you implement the policy without being chaotic? It should be very smartly planned so that there are no chaos which goes around with the
That's
vaccination
something that the
process.
administration will have to look at planning it so that it's not chaotic, like you said. Priya, I'm going to start taking questions now. How many doctors? Now, there's a question from Swaroop Reddy. He says, how many doctors who have taken 2 doses of vaccine have been infected by COVID in India in the second wave? So I don't know if there's data like that available in India yet. But
yeah, I can answer that. So there's no hard data on the numbers. Certainly, I personally know doctors who have become infected after getting 2 doses of the vaccine. The really, really important thing to remember is that the vaccine doesn't completely prevent infection. It does prevent serious illness and death. None of these people who got 2 doses of vaccine have needed to go to the hospital, have needed ICU care. That's the thing to keep in mind. So vaccines do work.
And I wanted to ask you, I mean, just that, do you think people from like say 18s to their early 30s, do they need to rush right away to get vaccinated? Or do you think, because, you know, there's a lot of chaos and a lot of people who need to get vaccinated, or do you think young people can still afford to wait it out a bit?
So it is so hard, that answer, just because right now India doesn't have enough vaccine. So I would certainly say that if you're young and perfectly healthy, and if you foregoing your dose will mean that some older person can get it, and you can save their life because of the vaccination, you should do it. If there are doses going unused, rather than it's sitting on a shelf somewhere, giving it to whoever steps up for it is an option. Young people do generally do well with infection, but they do spread to older people who can die from the infection. So ultimately, we need to vaccinate younger people too, but it's a really tough question. I don't have an easy answer.
And once you do get vaccinated, suppose you get your 2 jabs, you said you could get infected, but hopefully it should be mild, ideally. But this also means that you can carry the virus around to those who may not be vaccinated. So even if you get vaccinated, you can't really go back to life as normal, right?
Exactly. And that's, again, a problem. So you still need to continue to mask with the current situation.
Jagdeep Singh wants to ask, how do I explain the benefits of vaccine to people who believe in stories from WhatsApp University? I'm having a hard time convincing people to get the vaccine.
My answer to this will be that the 7 or 8 countries who have used vaccine up to 60% or some about 70 or 100%. These are some of the smaller countries, not only United States or UK or Israel. These are Serbia, Chile, Hungary, etc. They have all brought down the infection, and the European Union now is allowing people to visit again from some areas where the curve is very down or infection rate is down. So there's a very powerful thing of the vaccine efficacy. However, in India, now these mutants are infecting younger people, and seriously younger they are infecting. So that particular logic will not say the earlier versions, the young were not affected. Now it has changed its tack. The new mutants are affecting younger people also, very seriously also, and they are also going to ICUs. So at this given moment, the strategy has to be smart. So we have to see that who needs it most, according to the profession, according to the nature of work which they do. But we need to find out something in which we really serve the best. But vaccine really helps. And as it was told by Priya, that that those who have taken vaccine, although there is a difference between United States vaccines which they have used, they are 95% effective. Indian vaccines are 60 to 70% effective. 30% you may get infected, but in a milder version. When some of the hospital, and it depends on the situation. Like some of the hospitals, like All India Shoot, Gangaram, etc., massive number of doctors got infected. They had two doses, but they got infected because there was a very concentrated doses, or they were internally centrally air conditioned and other situations, and massive number of patients and people, so they got those exposure. But otherwise, if you have a normal exposure, if you have vaccinated and you are still wearing mask, you might get infected, but it will be milder infection. You will not go to ICU, you may not go to hospital either. But perhaps you will not spread the infection. Your virus level will be lesser.
Okay.
I want to say one more thing here, although you didn't ask this question. We were talking about oxygen. If you are taking a on prone position, you are taking breathing, you enhance oxygen. But there is another very good thing which Karolinska has done, which is known as humming. When you hum, the nitric oxide, which kills the virus, which enhances the pulmonary circulation, etc., comes out of your sinuses to your nasal cavity. Humming is it is not nilom vilom kind of thing. It is a Brahmarika yoga. And there is a lot of scientific paper now, and there is a product in Britain and Canada known as Sanotize, which is a nitric oxide spray. So this is something which I wanted to know all the people, that this particular thing will be, this reduces viral load by 97% by second day. So I just wanted to say this.
Humming. You can check that out. Okay,
Humming.
so Atul Prakash wants to ask, do we need to get ourselves tested before going for vaccination? I've heard people say that people are dying because they got vaccinated while being infected. So Priya, maybe you can take that. I don't think people dying because they get vaccinated is a hyperbole. I don't think you should go by that yet. But
No, you do not need to get tested, because if you get the vaccine during an infection, it does not hurt you. You may have more local side effects, but it does not hurt you. It does not kill you. The risk from getting vaccinated while you're infected is that you might infect other people at the vaccination sites. But if you wear a mask, that should be reduced. So there is no opportunity right now with limited testing. You should not be using up tests to just check whether it's safe to go get vaccinated.
And so suppose I've had the coronavirus, I've got it, I've tested positive, and I've finished my 14-day quarantine. I can then immediately go get vaccinated. How long do I have to wait after I've gotten infected?
You don't need to wait at all. The infection itself protects you from another infection for a few weeks. So if you wait, it's okay, but there's no minimum time that you have to wait.
How long can we be protected if we have gotten it once? Is there any
probably about 3 months. And again, with the new mutants and strains that are coming around, that window might be shorter. But when cases were stable and it was the same virus circulating, we know that it protected you for at least 3 months, possibly longer.
Okay. And one question I had, it's not here, but somebody on Twitter had asked me this to ask one of you, was for young mothers, if you've just given birth, or you're still breastfeeding, and you do get the vaccine, you get the jabs, can you pass on the antibodies to the baby, or how does it work?
Not really.
But sorry, actually there is a data now that you pass antibodies. The pregnant mothers who have antibodies or who had got infected, they have passed on antibodies to their babies. This data is there. There is some data now, not a large data, but this has been covered for whether you could infect the pregnant, immunize the pregnant woman or not. In influenza, infection. If you immunize the pregnant woman, you save the woman and you save the babies also. There is a new big strategy on mothers immunization is coming up. So in COVID, when we have a large amount of data, at this moment the data which is there, it shows that it is safe for pregnant women. Both Pfizer has collected its data. AstraZeneca has collected the data, but now because of the clotting problem, they have paused it. But there is a data with Moderna, there is a data with Pfizer about pregnant women. There's quite a big, not a very large data, but some data. So ultimately, I think it will be used in pregnant women. There will be, and the antibodies. There are publications where it is known that they pass the antibodies to the babies.
So I have a question for Dr. Ganguly, actually. From what I understand, the government of India has said you should not vaccinate pregnant women and women who are breastfeeding. Is that true? And if so, can you do something to change that recommendation?
Yeah, I have answered this, that women who are breastfeeding, they should get, because you pass the antibodies through breast milk, and you pass many other things through breast milk. You pass the cell population, which might be having immune memory. So you really protect the babies, and now babies are also getting infected with the mutants. So
no, but
it
I
has
was
become
asking about
urgent. So Government of India policies are made sometimes. The regulators want hard data, and in our country, nobody has collected data in pregnant women. Some or other they haven't. But in United States, in Europe, in Bahrain, they have collected data on this, and this data is becoming more and more sizable. But at this given moment, no regulator has actually allowed the vaccination in the pregnant women, but very soon it will come. But lactating women, there is no, it should not be really stopped in lactating women.
Okay, so right now it's only with regard to pregnant women that India is not allowing. But
nobody in the world is allowing at the moment. Nobody, but they will allow. Eventually, when a large body of data is available, they will allow.
Nowhere in the world, Priya, are pregnant women?
No, in the US, women are being allowed, and actually it's being promoted. So that's where we have the data that Dr. Ganguly was referring to. Thousands of pregnant women have been vaccinated. And if you think about it, the healthcare force often consists of young women in childbearing age. So it was very important not to have that restriction, to say these women who are putting their lives on the line, taking care of patients with COVID, should have the opportunity to get vaccinated.
Okay, next question, Priya, maybe you can take this. Around the world, most of the countries, especially Europe, are in a very deadly third wave. It seems like India is still in the beginning of its second wave. Can we expect the same trend in India? Should we expect the worst yet to come in India? If so, what can we do to stop it, as we don't see any European countries getting better sooner?
The problem with COVID is that the entire world needs to control COVID for all of us to be safe. Otherwise, we'll have these endless cycles of lockdowns. So the reason that Europe is having third waves is because restrictions were released in other countries. People are getting infected, and then people are traveling from one place to another, taking the infection to these new countries. And when there are new variants, vaccinations are not as effective. So the way to prevent a third wave is for the entire world to come together and have measures in place. So if USA cannot be safe unless India is safe, India cannot be safe unless Nepal is safe. The small, narrow-minded policies in certain countries has not helped the situation, including the US
Manisha,
not reaching out to help other people.
Manisha, can it also strengthen what Priya was saying? The best example is polio. Okay, although we are polio free from most of the world, there are two countries which have still polio. And the whole effort, I'm in a committee which looks at the post-polio scenario. So we have outbreaks with the vaccine-derived viruses, and we have these two countries. So till it is happening, nobody is safe in the world. And we cannot say that if United States is free or Europe is free, nobody else will have it. They will again have it. We have exported our mutants to many countries now, and they have exported their mutants to our countries now. So at this given moment, our effort will be that we should have a COVID-free world. If we attain that, if we really put the curve to zero transmission around the world, maybe this infection will peter out. But it is going to take several years. It is not going to happen tomorrow.
The sense I'm getting is that we can't be thinking of going back to life as usual, basically. Even after the vaccination, I mean, the masking, the social distancing, the being careful about gatherings is a long-term thing that we all have to understand. And I think one of the problems that happened in India is that after the first wave, we just went back to life with a vengeance, not using masks, doing our holy parties, doing our weddings, going out in the crowds, going back to bars, going back to restaurants, or cinemas. So this is a really long-term thing, which
Indian weddings. You have very rightly said. Those who know what is how is Indian wedding,
December
it is totally uncontrolled, totally uncontrolled.
Okay, now this is a very serious concern by Matt. I don't know if it's a he or a she, but the person says that I had pain in my thigh and blood in my urine after the first AstraZeneca shot. I'm 44 years, and in Europe, there's talk of waiting it out 3 months and getting a jab from another make. Are there any age-specific advisories for Indians? Do you want to take that, Priya?
I would, specific recommendations for Indians, maybe Dr. Ganguly wants to take it. I'll say just that, and there's a follow-up there that says it was due to a blood clot. So if it was a blood clot and the person who had the blood clot is getting blood thinners to treat the blood clot, given the current situation and the risks of getting COVID are so high, I would recommend getting the second shot, but I don't know if there are any India-specific recommendations.
Are there any India-specific recommendations?
Yeah. Like I will add on to this. Like many of the Indian girls who are younger, they might have a DVT, they might have a clotting problem. I know several of them who have resisted from getting vaccinated, but they are doctors, so they knew their condition. General population doesn't know. So there is a label advisory now in AstraZeneca vaccine that girls below this age, a particular age, should not take it or be careful if they're taking it. So for them who cannot take it, there are other vaccines which do not cause this. Like very soon the Pfizer has offered India to negotiate and send it. India is also making a messenger RNA vaccine. Problem is AstraZeneca and Johnson at this given moment. So there will be a cafeteria approach in vaccine, and maybe Sputnik will also have this problem. So there will be a cafeteria approach here. Those who cannot get or who have taken AstraZeneca, they can go to another vaccine. That is possible. Some people want to generate data that whether you are mixing vaccines, will they have some other adverse effect or other. In normal circumstances, people check it, but one of the advisory is that you could get another vaccine if you have trouble with one of the vaccines. So there will be a cafeteria approach. We will have 5-6 different varieties of vaccines made with different kind of platforms. And if somebody has a problem, but anybody who has a clotting problem or who is taking blood thinner or who has a DVT and other when thrombosis means DVT, okay. So they should desist from taking this vaccine.
You can take one more question, and we'll just try and take a few questions quickly now because we're running out of time. So I do have specific questions about importance of taking vaccines, AstraZeneca. What are the large possibilities of having cardiac arrest due to vaccines? what are the medical conditions where you could say it is not advisable to take vaccine, both Covishield and Covaxin?
So there is no hard data on cardiac arrests from the Covishield vaccine. There's risk of these clotting events that has been quantified. The risk is low, but it's there. And as Dr. Ganguly was saying, younger women, women who are taking oral contraceptives are at increased risk of these clots. Covaxin, there has not been really any published data, so we're kind of in the dark about the side effects. So the phase 3 trials have not been published, and there's been no published data on what's going on since the vaccination program with Covaxin began.
Actually, some people, Manisha,
where...
some elderly people, like this question I'm expanding, some elderly people who have arrhythmias or who have heart failures or who have cardiac condition, existing tachycardia, existing cardiac conditions, they should be careful. They should take advice of their doctors, stabilize themselves before taking it. But because these are the guys who can get a sudden attack while they are getting vaccinated, apart from the clotting problems or thrombosis and other things.
Okay. Now, this is a huge concern for a lot of people because we're in the middle of a shortage of vaccine. Now, a lot of people have gotten their first jab, but are unable to get their second jab because the stocks are over. So there's one question by an anonymous attendee who says, my parents were due to take it on 13th of May, but the vaccine center as of now doesn't have any stock. So does it go to waste, my first jab, if I'm unable to? Is there a stipulated time?
So there's no maximum time after which you have to start again. So if you get it, if they're due on the 13th and they can't get it, they get it even 15th of June. The vaccine, the first dose will still protect them, and the second dose will, when it's given, will continue to work just as effectively as if it was given on that due date. Vaccines efficacy is reduced when you give the two doses too soon together, but the efficacy is not reduced if you get it later than the scheduled date. So that's a really important point for your listeners who, it's going to be a problem around the country with getting second doses.
Shall I expand it a little, Manisha?
Yeah.
Like the United States data is very clear that first dose also protects for considerably protects. So, but in India, our vaccine efficacies are not the same as Pfizer and Moderna, which was largely used in the United States. So here in this particular pandemic, some one-dose guys are getting infected. Although severity is not that much, but they are getting infected in this particular surge. However, I agree with Priya that the major vaccine, which is the Covishield over here, if you take it a later period, if there is a gap of 1 month or even 2 months, it doesn't matter. So you can afford to wait. And India vaccine situation is going to improve in another 2 months. It is, you will have a lot of vaccines and choices here.
Great. So basically, don't worry if you had to wait.
Yeah.
What I'm understanding from both of you is that if it's too close, it affects efficacy. But if the wait is longer, it doesn't matter. It's not like your first vaccine will get nullified or whatever. So if the stock is not available, you can wait it out, but just get the second dose whenever possible.
Exactly. Perfectly stated.
Okay. Great. So I wanted to ask, I'm so sorry, we're running out of time. So I'm just going to take 2 questions and then we'll have to close this, but we're going to do this again because I'm seeing that a lot of people are interested in this and a lot of questions around this. Krishnan wants to ask, I wanted to ask, what are the riskiest comorbidities associated with contracting the virus? So the riskiest, and does it have an influence on Parkinson's patients who are currently consuming Syndopa or Levodopa?
So I will speak very fast because I want to get this information out. So the riskiest things that increase the risk of getting virus is really behaviors. So if you are not masking, if you're going out in crowds, that's what influences getting the virus. I think the caller wants to know what are the riskiest things for now progressing to more severe disease. And those are obesity. So being very obese is a significant risk factor. Older age is a significant risk factor. Some other things that are also risk factors, but not to the degree of these two, are things like high blood pressure, diabetes. So I think that covers the question. And then there was another second question there, was there?
Does it have an influence on
Parkinson's?
Who are
No.
consuming syndopa or levodopa?
No, I don't think there's any association at all.
Dr. Ganguly?
No.
Anything?
Yeah, there are many associations. They have not been proven, like cerebral palsy. If I understand, the risk factors people now know, the cardiovascular, diabetes, etc., etc. But there are some association with Guillain-Barré, which was not actually proven. Association with cerebral palsy, which was also not proven, because ultimately the percentage in the population is same. So these crop up sometimes, but there is not really not very, except the thrombosis or the clotting problems or bleeding problems. I do not find any really established risk in taking these, except very morbid patients who should be taking it under care, and those who have severe allergies of which they almost take anything and they get allergy. They need to be supervised, and when a doctor's advice, they should take this. So we need to have an advisory that if you have this and this, please take advice of your doctor before taking the vaccine.
So significant risk basically then is obesity,
Yeah.
hypertension, high blood pressure, which is the same as hypertension, right? Hypertension was also a risk factor. Mm-hmm. Okay. So last question, is a very common question that everyone asks, is risks of getting infected through home deliveries, packages. So surface transmission.
Yeah, the Food Association has been published in Japan and some other countries. The association with food, it depends on how you process the food and how you make the food. But the surface contamination theory has now died down almost. So people are not talking about that. People are talking about distancing and masking and other things. Hygiene, of course, hand hygiene and others. But surface contamination has not bothered. But there are studies and there are reports that the packaged food has spread the infection. Particularly this particular study, which was a stronger study, had come from Japan.
Anything you'd like to add to that, Priya?
I would say, please don't worry about it. There's so many other ways of getting COVID. The food packages, deliveries are minuscule, almost zero risk. So mostly cleaning, spraying, not necessary.
Just to a question that I've been thinking about was this air conditioners, causing, making it like you being more vulnerable if you're in an AC with somebody who has an infection. So if you're in a crowd, is it just better to, by crowd I mean you're meeting friends, 3 or 4 people, is it better for you to not be in an air conditioned room?
So it's not the air conditioning per se. A lot of people, in India say, they got sick because they had the AC turned on, meaning it was colder. That's not the problem. The problem is, for AC to be effective, the room has to be sealed well, right? Otherwise, you're going to waste electricity. So when a room is tightly sealed, the air is circulating within the room, and that increases the risk of infection. And it's so hot. I'm from India, so I understand how people want and need their AC. But if you have to have a meeting with people, opening the windows and turning off the AC would be a very good idea.
Just to add on quickly, the central air conditioning really was a culprit, because in restaurants it happened and it was reported because the air got concentrated around the place. But in India, the central air condition in hospital settings is causing a lot of infection. So we are now trying to make it more fitter by doing by coating the HEPA filters by coats, as well as directing the ultraviolet rays on them. So we are trying to do it. We don't know the actual effect. This is still on experimental stage. But the central air conditioning, where the air circulation is not that well directed and where they are not really fit, are not serviced very frequently and they are not fit. We don't know about air exchanges. In India, that's a problem in the hospital settings.
Okay, great. So we'll have to wrap this up. I think some very important takeaways on vaccination. Don't panic if you're not getting the second jab because of issues with the stock. You just have to get it at some point. Even a month's wait is not going to impact. It's not going to nullify the impact of the first jab, basically. So don't panic about that, because I'm seeing that a lot of people are saying that, okay, stocks are over. My mother hasn't been able to get the second jab. My father hasn't been able to get it. What do I do? Don't worry, just wait for it, but get it. And even if you have tested positive, you can get the vaccine. And even if you've tested negative, right after contracting the disease and doing your 14-day quarantine, you can get the vaccine. There's no waiting period as such. So you can basically go ahead and get it. I think that's important as we roll out our program with the vaccine from May 1st. I hope this was useful for all of you. Thank you so much, Priya, and thank you so much, Professor Ganguly and Dr. Priya, for taking out time. And I hope we can do this again, because there are a lot of questions that we haven't been able to answer. But thank you so much for your time, and I hope this was useful for everyone who's been here. We're going to be doing a lot of these sessions, so stay tuned, and maybe next time what we can do is we can have your questions in advance, so that maybe we can save a bit of time. I wasted a bit of time reading the questions this time.
I have one thing to say to Matt. I'm just reading the answer, and he's saying there's a game changer recommendation from CDC, and it was about taking off masks indoors. This USA is in a different situation than India. Please do not listen to any recommendations from the CDC. They do not apply to India now. So Matt, please.
Mask up. Really,
yes.
I this though, that we can.
Yeah. So when you go outdoor, go outdoor, you mask up. Not like United States.
Yes.
Basically, just mask up right now. We can't afford.
Yes.
And another important thing: don't worry about the cloth mask being wasteful. If there's no option, just
three layered cloth mask. 3 layered. What here people do, it is a very thin cloth mask because they don't have money. They sew it. So, and they do not fit that well. So better is a 3 layered cloth mask. That actually is protects better.
It fit. So
and most importantly, please keep it on. Sounds so simple, but people don't do it.
Okay. Thank you so much, guys. Good night. Have a good night, and stay safe and stay indoors as much as possible.
Good night, Manisha and Priya.